So now we're going to look at administering a secondary IV solution. And this many times is called a piggyback solution. So we're going to go to our MAR and find the correct patient. Our correct patient is winter snow. I've obtained the piggyback solution. In this case it's Levaquin, and it could be stored in the refrigerator. If that was the case, then we would have taken it out 30 minutes prior to being administered. It can be stored in a Pyxis system. There's many different storage areas to do that. So I've obtained the correct IV solution. So we're going to come to our MAR and we're going to check the 5 rights again. Winter snow, Levaquin, 500 milligrams, IV solution, and every 24 hours, and our time is the correct time. So we're going to go through the MAR 3 times like we always check with a medication. Winter snow, Levaquin, 500 milligrams, IV, every 24 hours, and it's the correct time right now. For the last time, it's winter snow, Levaquin, 500 milligrams, IV, every 24 hours, and the time is 1 o'clock. The expiration date on here is the 30th, so the date for our medication is accurate. So when we're checking her medications for winter snow, I'd also make sure that I look at her allergies. Winter is only allergic to, she has hay fever, so she's not allergic to any medications. So the Levaquin will be safe to give to Mrs. Snow. Then I'm going to need the tubing that I'm going to administer through. In this case, it is called secondary medication set. And this tubing has a small blue clip in it that'll help you remember that it's a secondary tubing. And there's an expiration date which might be really hard to see on camera, but it is up here in the corner, and the date is fine for that medication, so the expiration date is good. In this packaging, there's either one side or the other has perforations in it. This side doesn't, but this side does. So if I pull it, that's how I'm going to open this packaging. I'm going to take out our pieces of equipment. So there's the clamp. And it again has a paper tape to keep it from being twisted in storage. So that is how we're going to uncoil it. Make sure that the tubing is intact and no problems with it. Again, with any sets of tubing, the most important portion of it is taking that roller clamp and closing. And as you can see here, it's open. So I'm going to take the roller clamp and slide it down, and now it's tight onto that tubing, so no medication can run out. We're going to take the medication bag and we're going to pull the sterile cap off of it. And then we're going to take the cap off of the spike of the tubing. We're going to place that into the medication bag and twist and turn. It takes a little bit of push to get that in. So at this point, we could leave the medication room because we have it all set up, ready to go into our patient. Okay, so now we're going to go see Mrs. Snow and check our medication. So we go into Mrs. Snow's room, and I would wash my hands, make sure my hands are clean. Good afternoon, Mrs. Snow. I'm Ann. I'm going to be giving you your antibiotic today, but I need you to give me your name and your birth date. So she tells me it's winter snow, and her birth date is August 14th, 1959. So that's good. How is your IV feeling? Any soreness or tenderness around that IV site? So the site looks good. The IV solution is running well, and so there's no problem with the IV solution. So now what we're going to do is we're going to back prime our tubing. And when we back prime our tubing, remember I turned the roller clamp off so there's no medication that's running through. I'm going to go to the nearest port of the IV bag. So the IV bag here, and here's the nearest port. Some facilities are now using this swab cap, and this cap is placed onto the port so that it maintains the sterility of the port. If I have this cap on, I do not have to take an alcohol and clean the port because the alcohol is already encased into that little cap. So because I have the cap on, I can take off, this is my secondary tubing, and I'm going to take off the cap off of my secondary tubing. And then I'm going to remove this orange cap. I'm going to place the tubing in, I'm going to push it, and then I'm going to turn this little locking device on it, so now it's nice and secure. That's not going to come apart. But remember, we still have air into this tubing, so I need to back prime the tubing. To do that, what I need to do is open the roller clamp from the secondary bag, and that's going to allow the fluid to run from the primary IV bag back into the secondary bag. As you can see, that tubing, the fluid's running up and it is filling the chamber. The reason why we can do that is that the primary bag and the secondary medication are compatible. So as long as there's compatibility, this method can be used. Okay? Now, because this is a gravity-fed process, I'm going to hang the secondary bag up, but the primary bag has to be lower than the secondary bag for the gravity to work. So as you can see right now, the primary bag is dripping and the secondary bag is off. So what I'm going to do is I'm going to place this little hook device on the secondary, or on the primary bag, so that is lower than the secondary bag. So that's going to hang there. And now I'm going to open my secondary tubing and come down here and regulate the IV through the primary tubing. So the secondary tubing is open, and see how loose that clamp is, and we're going to regulate the rate of flow. Now if you look, the secondary bag is dripping, and that's what I would like it to do. Most secondary bags will run somewhere around a half-hour period of time, 20 minutes to a half hour. So I'm going to regulate that flow so that this 50 milliliter bag will run in over a half-hour period of time. And as that medication runs in, I would note that the primary bag is not running, so there's no drips in that bag. It's all coming from the secondary bag. So I'd make sure my tubing is good, my patient is comfortable, and I would come back in a half-hour period of time when that secondary bag has been completed. So our 30 minutes have gone by. I'd come back in and take a look. My secondary bag is now empty and there is no fluid that's dripping from that secondary bag. So now I need to come back and reset the primary bag. So I would take the clamp, bring it up and close the secondary bag off, and most likely my primary is not running at the prescribed rate. So I'm going to take the roller clamp again and adjust that rate to what is prescribed. And this might be done on a pump as well. Many times in an acute care setting we use an IV pump that would monitor the drip rate to do that. Okay, so once I get the rate to the prescribed amount, I would make sure that Mrs. Snow, that everything is feeling fine, your IV is not uncomfortable for you, good. And I will be back in an hour or so to check on your IV. I would have documented also that the secondary medication has been administered.